It looks like we're in the woods.
It does. We're not.
We are not in the woods. We are on the porch.
Yes.
Screened in. We have Rusty right next to us, so if you hear a dog panting, that's Rusty.
It's him. I also can't breathe very well sitting like this. I have a baby encroaching on my lungs these days.
Yeah.
Yep.
It happens.
It's only gonna get worse.
All right, let's
before
get
it
this
gets better.
a little closer. Okay.
So today's vlog, if you're new, welcome to our channel.
Hey, welcome.
I'm Rachel, this is Brad.
I'm Brad, nice to meet you.
Today's vlog is gonna be special because we're doing a collaboration, our very first collaboration.
Yes, we are.
Super exciting.
Yeah.
And it couldn't be with a better YouTuber.
Yeah. I remember watching Flip Side of the Moon's, like I remember when I watched my first vlog and I was just laughing. She does all these little sound effects that are just perfect.
Her editing it's meticulous and it's really well done, and she obviously spends a lot of time editing her vlogs, and they're all really, really fun to watch, really good. I'm forever indebted to, like a few months ago I said, if you guys watch any channels that are similar to ours, so I'm super flattered by that, similar in content, similar in subscriber count, let us know. And one of our subscribers mentioned this channel, and I'm so glad because she's my favorite channel now.
Yeah, you watch her every night.
Yeah, so her name's Christina. Her and her family live in southeast Wisconsin.
Go Midwesterners.
Is that where Milwaukee is?
Yes.
Okay, yeah. So she has 3 boys. Bo is 5, Kai is almost 3, and then Pax is 15 months.
Yeah.
So
what a fun,
she's a boy mom.
Yeah, what a fun age gap that is.
Yeah, yeah. They're really hilarious too. Like Bo is really intelligent, seems like for his age, and they're just super fun to watch.
Yeah. They better be intelligent with parents as successful as theirs.
No kidding. So Christina, as a profession, is a former PA. She did primary care and emergency medicine, and her husband's an oncologist hematologist. So,
and Christina now stays at home and takes care of the kids. And so we thought it was just a natural collaboration between the two of us. You know, since we're eye doctors, she's a PA. We took it to Instagram and had you guys ask questions.
Yeah, if you don't follow us on Instagram, it's just at Brad and Rach. It was really interesting how we did it. So we asked questions for her. She's gonna answer those in her vlog that she released today. So go to her channel, subscribe, like her videos. Unfortunately, her comments are disabled, like a lot of family channels are.
Yeah, like the whole YouTube thing.
So the thumbs up, the likes are really important on those channels because otherwise they just get lost in the YouTube algorithm.
Right.
So our questions on our Instagram post are being answered by her, and her questions on her Instagram post are being answered by us.
Right, exactly.
Yeah, so definitely make sure you go to her channel. I can't overstate.
I think you have a woman crush.
I do. I definitely do. She's awesome. I wish we lived closer because like I know we would be friends in real life. She's amazing. Yeah. And she's hilarious and witty and like tongue-in-cheek, like her joking, dry humor at times it reminds me of myself.
No wonder you love her so much.
I know.
All right, let's get to the questions.
Okay, sounds good.
So
a couple of questions that were asked had to do with babies and their tear ducts. So I'm gonna kind of lump those together as a general comment on babies and their tear ducts. So when babies are born, I don't know what the prevalence is, but it's fairly high, maybe like 30%.
High, yeah.
They're born with the ducts that drain their tears are blocked somehow, and it's usually something that resolves on its own. I think it's like 90% resolved before the age of 1. So things that you can do to help that along is do just like a warm compress over where the tear duct is, and that can just help get the valve released. Occasionally they need a surgery to like open up the valve so that the tears will drain, but when they have this, they're also prone to like bacterial conjunctivitis quite a bit more. I'm
surprised no one asked about breast milk in the eye.
Yeah, there's some truth to that. There are antibodies in that. So.
Yeah, it's totally fine to use a little breast milk in the eye, as opposed to an antibiotic.
So it's called a nasolacrimal duct obstruction, and again, very common, and most of the time resolves on its own.
So there was a lot of questions about that. There was also a lot of questions about astigmatism. For some reason, there's a horrible stigma around astigmatism. Like, we get asked it every single day by multiple questions, like, do I have astigmatism?
Or I have a really bad family history of astigmatism.
Yeah. So yeah, it is genetic. Pretty much about 90% of glasses prescription, contact lenses prescriptions that we prescribe, the patient has a little bit of astigmatism.
I would say 99%.
All that it means is that the cornea, which is the clear front part of your eye, it's not a perfect sphere. And so when light rays enter your eye, they just need a little extra help at a certain axis. It's really not a big deal. yes, absolutely, you could wear contact lenses.
And you can get LASIK.
And yeah, you're probably also a great candidate for LASIK.
Unless it's too much. I mean, there's parameters for every nearsightedness, farsightedness, and astigmatism for LASIK. So there's limits, but it definitely corrects astigmatism.
And we both are big proponents for LASIK. It's a great procedure for the perfect candidate. There's things that, you know, like dry eye syndrome, having a really high prescription. There are some things that we would say, you know, LASIK's probably not great for you. But most people in general are great.
Another really common question was about blue light. I'm gonna lump together, there were some questions about screen time, screens in general, blue light, do blue light filtering glasses help, all of those things. So what we know about screens is that they can cause discomfort, eye fatigue. There's something called computer vision syndrome, and it has to do with like a few different things. For one, your eyes are tonic focused right here, which causes them to be flexed and straining. For two, the computer puts out glare. We're also doing some research into the blue light that's emitted from screens, and that can cause general discomfort. It can make it kind of hard to see after you've been staring at that screen for a long time. Thirdly, when you're staring at a screen for a long time, we've done research that shows that we don't blink as often when we're doing that. So blinking is required to produce tears, so your eyes get dry. So a combination of over-focusing up close, your eyes getting dry, and then the strain and discomfort caused by glare and blue light, all of those things come into play when you're on screens. So as far as actual damage to tissue, we're doing research, but we don't think so. And when I say we, I don't mean us too. We are not researching this.
Scientists.
Yes. But as far as we know, no physical damage to the eye, just discomfort.
However, it does disrupt your circadian rhythm. So screen time at night, it's probably, you know, not good for you because your body's not going to produce the melatonin that it takes to fall asleep.
And that's specifically the blue light that's emitted.
Exactly.
So they have filters, but I would just say as a rule, no screen time within an hour or two of bed. And then you won't be disrupting your sleep.
Right.
Let's hit floaters really quick.
Oh yeah, so floaters, the eyeball itself is filled with a substance called vitreous humor. Mm-hmm. And vitreous, when you're born, it's a perfect gel. As you get a little bit older, there's a process called liquefaction where your vitreous starts to break down, and that's when pockets of proteins and cells develop inside of the eye. When light rays enter the eye, they hit that pocket, cast a shadow on the back of your eye. That's what a floater is. Floaters are perfectly normal to an extent. When we worry about floaters is a brand new onset of a bunch of floaters, almost like someone's pouring pepper over your eyes, flashes of light out in your peripheral vision, or like if a curtain comes over your vision. That's when you're like, oh no, I need to go in, get a dilated, comprehensive eye exam by an eye care professional.
If it's a weekend, go to the ER. So in a nutshell, if you've had this floater forever and your doctor has looked at it and said normal, normal. Anything new, definitely get it checked out. So, and floaters are what we call an entopic phenomenon, which is some type of visual thing that you see that isn't truly there. Well, I mean, it's inside the eye. It's not, like a lot of people feel like their floaters are a bug floating around that they can swat.
Like they can't swat the fly.
It's actually inside the eye, and there's no exit to the eye, so it just unfortunately stays in there forever, and hopefully with gravity will settle down to the bottoms of the eyes.
One more thing, a lot of patients come in and they're apprehensive about the doctor dilating their eyes. There's no systemic side effects to the dilation drops that we use. So if your doctor recommends we dilate your child's eyes, please trust them.
Definitely. It's really important in kids because it not only gives us a great view into the eye and the eye's health, there's a lot of parts of the eye that we can't see unless we dilate, but it also relaxes their focusing system so we can get a much more accurate glasses prescription. So in certain kids, that's crucial to know exactly what their prescription is, and it's frustrating for me when I know they probably have some prescription hiding and the parent won't let me dilate them, and I can't give them the best pair of glasses for them.
Check out Christina's, or Flip Side of the Moon's channel.
Yeah, we'll have a link to her channel below and a link to today's video that's answering your questions for our PA. She's our surprise PA.
And we'll definitely do this again, so if you have more questions, go ahead and ask them.
Yeah, so enjoy the rest of today's vlog. Just a few Saturday morning cartoons, playing with some choking hazards. So this package of food that we actually got from a subscriber. Good job, Bear. Good job. Putting them in the basket. Had a ton of food, and we have some of it out to have in the kitchen, and then I put a bunch of it away, this whole basket, because there was so much, and they would just like dump it out, and it was kind of like the Lego situation where I was just constantly picking up food. But I also pulled aside a whole basket that is choking hazards. And then yesterday, were you trying to find something for them to do?
No, they came in the pantry with me and grabbed it.
Oh, so they grabbed the basket full of choking hazards. I should just throw them away. I don't know why I even kept them.
Or that, or put it up. It was literally on the lowest.
The kid shelf?
To the door.
Yeah.
Maybe not.
Maybe.
Because they're definitely going to want to cook hot dogs when they're 3 years old. Bear's favorite part of his morning, waking up his sister. All right, let's go, buddy. Let's wake up Linda. Yeah. Say good morning, Linda. Good morning. There she is. Lawnmower? Hi, honey. Bear. What's Bear doing? Oh, he's playing with your blankie. Do you want to pull it? Say, Bear, that's my blankie.
Bear.
Bear.
Mama.
Mama's making oatmeal. Are you ready to get up? Bear, you want to get in there? All right. Well, I got one out and one in. Are you ready, Bear? You ready to get out? No? Okay. Your hair looks great, honey. People would kill to have your hair. Do you see it? Say hi. Good morning, Junebug. Should we say goodbye to Bear? Bye-bye, Bear. Bye-bye, buddy. All right, let's get him up. What's going on over here? Ha 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 ha. Because the water table's not enough and the pirate ship pool's not enough, we had to put the water table in the pirate ship pool.
Exactly.
Just kidding, we didn't really need to, we just wanted to.
Good job.
These kids are loving it.
So is their mama.
Yeah.
I guess the base of the palm tree is connected to this part.
Yeah, I need to go grab the pump and pump it up.
Pump it up. I tried to blow it up more,
Pump
but
it
I
up.
blew up the leaves more.
Yeah, exactly.
Not helpful.
Well, and I was gonna pump this up with my own mouth, but when I opened the thing, like air just gushed out.
Oh.
So you definitely need a machine.
Oh.
Yeah.
Your lungs aren't strong enough?
No.
Good job, Bear.
Good job. So we are in serious consideration of adding on to the house.
Yeah, the topic came up again last night where we're just deciding what to do. I mean, there's a pretty decent time frame where the baby goes to bed really early. Like, well, with them anyway. They, from like, I don't know, 4 or 5 months until they were maybe closer to a year old. They went to bed at like 6:30 or 7. And I'm just not sure what to do with the new baby when they're in that time frame. It seems ridiculous to add on to a house just for like that time frame.
Well, what we could do obviously is put them in the same room and put the baby
In their own room.
right in the back room.
It'll just depend.
Yeah, I mean ideally we would want 3, well, a total of 4 bedrooms.
Right.
But it really wouldn't be that big of a deal to just add an office right here. When we bought the house, we bought it from the builder, and he quoted us like what it would cost to add the office on, and it's not that much, especially if we just rolled it into our mortgage. It would only be, maybe 20 bucks a month. So we're contemplating it, and having a home office, I feel like, because this house is kind of small, like having a home office would be, I mean, it wouldn't add a ton of value.
Do you think it would pay for itself though?
Yeah, see, that's the thing. I don't know if it would pay. It probably wouldn't pay for itself completely, but it would add a little value to the house. And honestly, I wouldn't mind having a home office.
Me too.
But we're not
used use it.
Well, the thing is, we won't use it. It'll be a bedroom for the kids.
Well, until they start sharing, and then we could use it as an office.
If they ever do start sharing.
Yeah.
But I feel like anybody that would buy the house would like appreciate a home office. I mean, why wouldn't they?
But think of it this way. So like part of our reasoning for purchasing this house was that it could possibly be our house for the next 10 years or so. And if it's between making this more comfortable or bigger or more useful to stay here versus building a new house, there's a clear difference in total cost there.
Right.
For us. So I think we should just do it. I didn't even think about rolling it into our mortgage. I just thought we would cash flow it. But rolling it into our mortgage, definitely we should just do it. So once again, definitely make sure you go to Christina's channel, Flip Side of the Moon. It's in the description below. Subscribe, thumbs up her videos, please. She's amazing, she deserves it. She doesn't have comments, so she could really use the help of the thumbs ups. And she's also on Instagram, so we'll leave a link for that below. She's hilarious, you guys are gonna love her.
Yeah. Thanks again, Flip Side of the Moon, for collaborating with us.
Yeah, and we'll catch you next time.
Bye.
Bye.